Hi, I'm Dr. Kerry Tapuzian, and this is Ask Dr. T. Today's question is in regards to menopause and natural hormone replacement therapy. Most women think that menopausal symptoms are basically hot flashes, mood swings, and night sweats. But there's really a lot of other symptoms, and let's talk about some of those right now. And there's really a lot of them, and I'm going to point out some of the ones that you may not necessarily think are related to perimenopause or menopause. And these symptoms can start as early as 35 years of age, unfortunately. Obvious ones were the hot flashes, night sweats, vaginal dryness, anxiety. But if you look, there's things that you might not think about, like insomnia, flatulence, indigestion, aching ankles, knees, wrists, just total, body aches and joint aches. Switch over here, look at these: bloating, palpitations, varicose veins, weird dreams, panic attacks, painful intercourse, loss of libido or sexual interest. And then some other ones like hair loss, frequent urination, snoring, which someone will probably tell you about, weight gain, memory lapses. There's a lot of things that you might not realize. And also there's three main hormones for menopause. There's estrogen, testosterone, and progesterone. And usually the first hormone to go is progesterone. And some of the symptoms that you may be having with that are insomnia, panic attacks, mood swings, heavier periods, sore breasts. These are signs that maybe your progesterone levels are starting to drop. Now, let's talk about the difference between natural hormones and synthetic hormones. We're going to switch to another little diagram here because we're going to get a little technical. And what we have here is this is actually chemical structure of natural or bioidentical progesterone, which is one of your three hormones. And down here we have a synthetic hormone, which is also called Provera. Now, when you're taking natural or bioidentical hormones, it's the exact same structure that is in your body. Your body can't tell the difference. And actually, they're made from wild Mexican yams. Yes, wild Mexican yams is the base that they use to start making these hormones. And they can be found at most compounding pharmacies throughout the area, which are local apothecaries, which produce these natural hormones from scratch. Now, this is a compound that's made by a pharmaceutical company, basically, and what they've done is they've just tweaked it. They've added some things to it so that it kind of still looks the same, but it still is a little bit different. The key pretty much looks the same, but it just doesn't work exactly the same way as your natural hormones do. And because of that, you can get some side effects as well as benefits that you can get with the synthetics. For example, with synthetic progesterone, which we call progestin, it can cause coronary artery spasm, which means you can have the blood vessels in your heart can actually constrict, and that's a risk factor for having heart disease, which actually the Women's Health Initiative, which was done a few years back, found to be true. Talking about another hormone, testosterone, methyl testosterone, which is a synthetic version. It's available in this country, but it also has a risk factor for causing liver cancer, and it just happens to be outlawed in Europe. Okay, what do they know that we don't know? Now, the other thing, too, is testing. As far as testing hormones, how do you go about testing for them? And there's three basic ways that you can do that. We can do saliva testing, blood testing, or 24-hour urine testing. And my favorite is doing saliva testing, and for the following reasons. It gives you multiple snapshots or multiple windows as to what your levels are, because it's not just a one-time test. You're actually testing levels over a week period, and in some cases over a month. It also gives you the free levels, the actual hormone that your body can actually utilize. Comparing that to blood testing, you're usually just getting your blood taken at one time, and you're getting a one snapshot or one window of what your levels are. And when they take your blood, what they do is they centrifuge it down, they spin it down, and they'll take the top portion of it and discard it before they figure out what your hormones level is. Unfortunately, when they do that, they're throwing away some of your hormones, so you're going to get an abnormally low level. Now, another question that often gets asked is, I'm over my symptoms. I'm not having hot flashes anymore. I'm not having night sweats. I'm over menopause. Why do I need to take hormones? Well, the answer to that is you've got to think about it this way. Before you were going through menopause, your hormone levels were up here. Then as you're going through perimenopause and menopause, your levels, they're just going all over the place, and that's why you're having your symptoms. And then once you stabilize, you're down here. You've got low levels, but the hot flashes and night sweats, they've gone away. But at this level, you're not getting the same benefits you were getting from when your levels were up here. So what are those benefits? Let's talk about what some of the benefits of the different hormones are. And again, we've got three basic hormones we're talking about. The first one is estrogen. And there are actually 400 different benefits of estrogen. I've just got a few that are actually outlined here. But you'll see after going through them that they're all pretty important. Okay, improves sleep, works as an antioxidant, helps maintain your bones, so it's going to prevent osteoporosis. Prevents Alzheimer's disease, okay? Increases metabolic rate, which means it helps keep your weight down. When you have a lower metabolic weight, you're going to increase weight, which is very common during menopause. Regulates body temperature, helps maintain muscle, increases sexual interest, so it's part of your libido, decreases wrinkles, protects against macular degeneration, that has to do with your eyes. Okay, and the list goes on. Decreases risk of colon cancer. I mean, these are all very important things. Let's go to the next hormone, because they're all important. And you don't want to just replace one. You want to make sure that they're all balanced together. Benefits of progesterone. Helps balance estrogen, so it's very important to use with estrogen. Helps with sleep. It has a natural calming effect. Helps eliminate fats. Lowers cholesterol. May protect against breast cancer, increases scalp hair, increases metabolic rate, again with that weight gain thing, and it's a natural antidepressant. And then the last but not least is testosterone. Women need testosterone as well, not as much as men, but it's important, and it has some of the same benefits that it does in men. Again, libido, it's very important. And what you may notice is that all three of these hormones, it had, as one of its things, it had libido, or sexual interest. You can't just replace one. All of them have to be balanced, or else if you've lost your libido, it's not going to come back. You can't just fix one. You've got to look at all the hormones. Increases muscle mass and strength, decreases excess body fat, helps maintain bone strength. This is a good one. Increases sense of emotional well-being, helps maintain memory. What was that? Helps skin from sagging, decreases excess body fat. As you can see, they're all very beneficial. Now, how do we treat with these? How do we actually administer these? Well, there's a lot of methods. Either it can be taken as a pill. We have lozenges that can be used. They can be used transdermally, which means like as a cream used on the skin. How do we decide how we're going to use these and what method to use them in? There's really two things we look at. We look at the person to see how they want to utilize their hormones, because if they're not going to take the time to rub in their transdermal or skin preparation, then you're better off giving it a different way. It also depends on the symptoms. For example, if one of your main symptoms is insomnia, you want to be able to give the hormones in a way that's going to fix that problem the best, and that's most commonly done by taking it by mouth. If you're having problems with libido, vaginal dryness, incontinence, frequency, urgency, then a lot of times what we'll do is we'll use it as a transdermal preparation, and in some cases as a vaginal transdermal preparation. Now, are there any side effects, or are these hormones safe? Well, you got to remember, testing is very important. You can't just start taking hormones and not periodically test your levels. So you have to see how your levels are being maintained over different periods of time. You have to make sure that you're taking all of your hormones. If they're all low, you can't just take one hormone, because, for example, let's say that you're just taking one out of all three hormones. You can have symptoms that are similar to some of the symptoms that you're having in the first place. Headaches, waking up extremely fatigued, breast tenderness, heavy periods, periods stopping all completely. So it's very important to monitor levels and to monitor all of your levels. Now, is this alternative medicine, holistic, voodoo medicine, or would you just call this common sense medicine? My name is Dr. Kerry Topouzian, and this has been Ask Dr. T.